Hi there, this is Tom Corson-Knowles, the Authentic Health Coach, and today we're going to talk about vitamin D and how it affects your health. Now, in this video, we're going to show you exactly how you can get less colds and flus, especially in the wintertime. We're going to show you how you can reduce your risk for heart disease, cancer, stroke, autoimmune disorders, and much, much more. And we're going to tell you how you can help your genes function better, and how you can improve your quality of life with vitamin D. Now, this is a disclaimer. Statements made in this video have not been evaluated by the Food and Drug Administration. Any information presented in this video is not intended to diagnose, treat, cure, or prevent any disease. And furthermore, you might actually learn something useful in this video that could dramatically impact your health in one way or another. So, ahead of time, be warned. Now, vitamin D. Vitamin D is what a lot of people call the sunshine vitamin. And the reason they call it that is because vitamin D is created in your sun from exposure to sunlight. And this is crucial. This is how you get vitamin D. It's how you need to get enough vitamin D to be healthy and to function properly. And the problem is most of us just don't get enough sunlight today. There's a lot of factors that inhibit our exposure to sunlight or reduce our body's ability to create vitamin D, such as being indoors. So if you're in the office all day, even if you're next to a window and the sun's shining on your face, you might feel the heat of the sun, but your skin isn't being affected to the same rays of the sun. It's blocked out by that glass, and so your body can't create vitamin D in the skin, and so you're going to be deficient in vitamin D. Other things that block our body's ability to create vitamin D include sunscreen. So if you wear sunscreen when you go to the beach or something like that, you're actually blocking your body's ability to create vitamin D. And then, as well as most of us just tend to stay indoors all the time. We don't really go outside. That's another factor that contributes to not getting enough vitamin D. And the third factor is how far away you are from the equator. So where I live in northern Indiana, above the 45th parallel, we actually don't get any, it's physically impossible for you to create any vitamin D at all for about 6 months out of the year here. And the reason for that is because the sun is so far away in the wintertime and in the late fall and early spring that your body just doesn't get exposed to those rays of sun. So even if you're outside naked in December in northern Indiana, you're running around outside naked for 12 hours and it might be a sunny day, but you're not actually getting enough exposure to any of the rays that actually help your body create vitamin D. So those are all factors that are why we're so deficient in vitamin D today, and we're going to talk more about that. Now, vitamin D works with over 2,700 genes in your body. So it's a very, very special chemical. It's actually not a vitamin, it's actually a hormone. And so it impacts cellular communication, and it impacts how your body functions on so many levels. And like I said, it works with over 2,700 genes, so it's very, very important. And many of these genes are linked to many of the diseases that so many people face today in our country, including heart disease, cancer, stroke, diabetes, and on and on. And we're going to talk specifically about these diseases here in this video and in this series of videos. But here's just a clip from CNN Health in August 2009. It says, the headline says, vitamin D deficiency is common in U.S. children. A whopping 70% of American kids aren't getting enough vitamin D, and such youngsters tend to have higher blood pressure and lower levels of good cholesterol than their peers, according to 2 new studies published this week in the Journal of Pediatrics. Low vitamin D levels may also increase a child's risk of developing heart disease later in life, experts say. We were astonished at how common it was, says study author Dr. Michael Melamed, an assistant professor of medicine, epidemiology, and population health at the Albert Einstein College of Medicine in the Bronx, New York. He continues to say, there is a lot of data that suggests adults with low vitamin D levels are at risk for diabetes, high blood pressure, cardiovascular disease, and a lot of cancers. And if kids start out with low levels and never increase them, they may be putting themselves at risk for developing all of these diseases at a much earlier age. So it's a very, very serious deficiency that we have of vitamin D in the United States, and it's likely to be very similar in much of the Western world, especially the farther away you are from the equator. So it includes Northern Europe, Northern Asia, Australia, South Africa, and southern parts of South America as well. So let's talk about vitamin D and multiple sclerosis, because this has been well known for many years by researchers and well noted by doctors and scientists alike that vitamin D may actually lower multiple sclerosis risk. And it does this, we think, by suppressing cytokines, which are involved in inflammation. Cytokines are small molecules that help cells communicate, and as a result, vitamin D may actually lower inflammation and may lower your risk for multiple sclerosis. Now here is a map of the prevalence of multiple sclerosis throughout the world. It's an epidemiological map of multiple sclerosis. And what you can see in this map is that the farther you are away from the equator, the sicker you get. And the closer you are to the equator, the less MS you get, the healthier you are. And we'll continue this in the next video.